Okay, thank you for joining me today to go over some of the commonly made errors in transcription. There is so much to learn in this program, but sometimes isolating each error and really understanding the error can help to avoid making the same mistakes in future reports. Let's put ourselves in the shoes of an auditor or a QA specialist today and look at examples of transcription to determine if they are correct or not. Thyroid is slightly firm without discrete mass or nodule. Take a look at that statement. Does that look correct? This is a common phrase we might hear when a doctor is examining the patient's neck. This is something that a speech recognition engine would also type. Does it look correct? It's incorrect. Thyroid, slightly firm with discrete discrete mass or nodule is the correct way to do that. We had discrete with two E's at the end, and those are two sound-alike words. Discrete with two E's means reserve in one's speech or behavior. Discrete ETE at the end means separate or individually distinct, as in a discrete mass. Be really careful of these sound-alike words like discrete. If you come across an error that you've made a sound-alike word error, look up the meaning of both the way that you did it and the correct way. This is really going to help the next time you hear that word. Appendix B in the Book of Style has a great list of sound-alike words. Sometimes they're sound-alike words that we didn't realize that there was two different spellings. So it's good to review that on a regular basis. Okay, the patient was sent to gastroenterology for investigations of abdominal cramps. We're looking here at a capitalization of gastroenterology. Is this correct or incorrect? Would you capitalize gastroenterology here? We'll take a look. It is correct. We're going to capitalize when referring to a specialty as an entity. Count Specifics goes over this, but I just want to let you know that many students struggle with capitalization of specialties. So how do you know when to capitalize a specialty? First of all, let's look at what's considered a specialty. A medical specialty is a branch of medical practice that is focused on a defined group of patients, diseases, skills, or philosophy. Examples include those branches of medicine that deal maybe exclusively with children, that would be pediatrics, cancer, that would be your oncology field, laboratory medicine, that'd be pathology, or primary care, family medicine. What I do is I like to think of the specialties as ologies. Ology, as we know, is the study of something. Although it's not always the case, a specialty will often end in ology. A tip that works most of the time is to substitute Dr. Smith in place of the specialty. If it sounds grammatically correct, it should be capitalized. For example, patient was referred to gastroenterology. Patient was referred to Dr. Smith. That sounds grammatically correct. In that case, we would capitalize gastroenterology. Patient referred to the gastroenterology department. Patient referred to Dr. Smith department. Well, that doesn't sound correct, so we would not capitalize in that case. Okay, similar but different. The patient was seen at the emergency department because of chest pain. In this case, would we capitalize emergency department? Incorrect. Do not capitalize when it is non-specific. So our example here is the patient was seen at the emergency department because of chest pain. He was seen at the emergency department. It was generic, non-specific. The patient was seen at the Toronto General Emergency Department because of chest pain. Very specific. We know exactly which emergency department that patient was seen in. So the emergency department is not an entity, it's a place. Capitalize the name of any department or clinic that follows the name of the facility it belongs to. In this case, the Toronto General Emergency Department. Otherwise, it's generic, and it could belong to any facility, and it would not be capitalized. Count specifics, again, goes over this in more detail, but I'd like to give you an example that I use that works most of the time. If you had to go to the emergency department, let's say you live in Vancouver or Toronto, a big city. So you call your taxi and you say, take me to the emergency department. The taxi is not going to know which emergency department we're going to. That becomes a generic term. He's going to turn around, or she's going to turn around and say, well, which one? That means it will not be capitalized. But let's say I jumped in that cab and said, take me to the Toronto General Emergency Department. The answer of the driver would be okay, and they would take you to that specific department. In that case, it would be capitalized. Which of the following assessment is performed after the birth of an infant? So you're going to see this with birth of an infant, cesarean sections, that kind of thing. You're going to hear this word APGAR. Is it APGAR all capitals, or is it APGAR just with the first capitalized, or would both be acceptable? Do they mean the same thing? Let's take a look. APGAR. We want the APGAR that is not all capitalized, but the first letter is capitalized. So an APGAR is an assessment of a newborn's condition. APGAR refers to a family assessment. And there's more information on this in the Book of Style 15.2.1. But just to give you an idea of how this works, the APGAR score is an eponym named after Virginia APGAR. So we know that an eponym is something that's named after a person. So in that case, we would just capitalize the first letter. So the APGAR score is actually, it's a quick test performed on a baby at 1 and 5 minutes after birth. The 1 minute score determines how well the baby tolerated the birthing process. The 5 minute score tells the healthcare provider how well the baby is doing outside the mother's womb. It helps to measure how the baby responds to resuscitation if it's needed after birth. So this is related to the birth. The test is looking at breathing effort, heart rate, muscle tone, reflexes, skin color. Each category is scored 0, 1, or 2, depending on the condition. So that APGAR eponym is in regards to birthing, and that is how it's spelled. Now, there is such a thing as an APGAR all capitalized. This is an assessment for a family system that can be helpful in assessing the family's resources and functionality. It is an acronym. So each letter stands for something. In this case, APGAR stands for adaptation, partnership, growth, affection, and one more thing, sorry about this, resolve. So that is where this eponym comes in. That's why it's all capitalized. Each letter stands for something. Or I'm sorry, this is where the acronym, I said eponym, I'm sorry, where the APGAR, where the all capital letters, it's an acronym, so something totally different than the APGAR, which is the eponym named after a doctor. A discectomy refers to the eye. So if we saw that, the doctor performed a discectomy using a C, we would be talking about the eye. True. Disc with a C refers to the eye. Disc with a K refers to the vertebrae. So if we're talking about the spine, we're talking about disc with a K. If we're talking about the eye, we're talking about disc with a C. BOSS 16.1 and 14.2.2 have got more information for you on that. Which of these is formatted correctly? The patient has Alzheimer's disease, or the patient has Alzheimer's disease. Let's take a look. The patient has Alzheimer's disease. We could say, though, the patient has Alzheimer's. Book of Style 5.3.7 has got some good information on eponyms that you're going to want to read. But like I said, here we have another eponym. Alzheimer's is named after Dr. Alois Alzheimer. So that's where we're always going to capitalize an eponym because it's named after someone. But if an eponym is followed by a noun, the apostrophe S is dropped. If the eponym is not followed by a noun, an apostrophe S is added. So in this case, the patient has Alzheimer's. We would use the apostrophe S. There's no noun following it. Or the patient has Alzheimer's disease. We are going to drop the apostrophe S and because we've got disease, a noun following it. This would hold true if I said something like Parkinson medication. Medication is a noun, so we'd have no apostrophe S on Parkinson's. But if I said the patient was on medication for Parkinson's, it's all by itself out there, no noun following it, then we would do apostrophe S. A quick test, which I think is super handy. Sometimes you don't know if you're dealing with a noun or not, or what kind of word you're dealing with. I just would go on to Google and say, define medication. And it's going to tell you if it's a noun, a verb, whatever word you're putting in there, it will let you know what you're dealing with. So if you've got Alzheimer with something following it, you're not sure, check it out on Google. So look for the noun following to determine whether you've got the apostrophe S or not. Okay, back to the childbirthing, which is correct here. The birth weight was 8 pounds, 4 ounces. This is abbreviated. The birth weight was 8 pounds, 4 ounces, fully spelled out, no comma. Birth weight was 8 pounds, 4 ounces. Might want to think about that one. This is an interesting one. Okay, let's take a look. B is correct. Birth weight, it's 8 pounds, 4 ounces. When we do not abbreviate non-metric units of measure to express weight. BOSS 9.2.2, it's got more information for you there. But basically, had we said the baby was 3,743 grams, which you might often hear, which is the equivalent of 8 pounds, 4 ounces, we would abbreviate grams to G because grams is a metric measurement. If we said the patient was 5 feet 2 inches tall, we would spell out feet and spell out inches because that's part of the imperial system. So we've got the metric system, which uses things like meters, kilograms, liters, that type of thing. The imperial system uses inches, pounds, and gallons, that along those lines. So whenever we're using the imperial system, not the metric system, spell it out. Using the metric system, we would abbreviate if it was following a number. So in this case, the grams would work. I want to also point out one more thing here. There is no comma between 8 pounds and 4 ounces. In our previous example, we had one choice that you could put a comma after 8 pounds, but there is no comma when you are referring to weight. It's just all together. It would hold true if I said the patient was 5 feet 2 inches tall, no comma. Okay. Okay, we've got this. If this was a sentence that was at the start of a report, for example, would this be acceptable? 58-year-old male was seen today in follow-up. Or I'm sorry, 58-year-old male was seen in follow-up today. That's exactly what the doctor said. Could we just type we're verbatim account? Does that work? Well, let's take a look. It would be incorrect. We do not start a sentence with an Arabic number. So the correct way to do this would be to add a small word like a 58-year-old male or this 58-year-old male. Count specifics covers this. Book of Style covers this. There are some exceptions to this where dates and values that stand alone under a heading can begin with an Arabic number like 30 milliliters. So remember, if you have this situation, we can add a small word like a or the to alleviate the issue. Or the number could be written out. However, as our account specifics advise, we should use Arabic numbers. So we should always try to accommodate that first. So if we can solve this issue with adding a or the in front of it, issue solved. Remember, if the number represents a dosage or a lab, the sentence will need to be recast. So if the doctor said, yeah, the number before the lab reading, like sodium or 28 sodium, which would be a very strange thing to say, but if he did, we would recast that to say sodium 28. As mentioned here, if we've got a heading and the only thing under it is the number, like blood loss 30 milliliters, that is acceptable. So if it's standing alone under a heading, that works. Another example might be something like 10 milliliters was injected under the skin. We could say then 10 milliliters was injected under the skin. So just to avoid that starting with an Arabic number. Okay, which examples is or are hyphenated correctly here? We're talking about sutures here. So we're going to see this a lot in our surgical reports. So we've got 1-0 nylon, 0- 5 French catheter. Let's take a look. Okay, it's A. It's a 1-0. Now the doctor's going to say 1-0. This is how you're going to hear it, but that's how it should be formatted. 1-0 nylon is correctly formatted. We have no hyphen between 0 and nylon in our second. We should not have a hyphen, and catheter should be hyphenated between 5 French catheter. So we never place hyphens between the suture size and the suture type. Book of Style 7.3.16 is a chapter entitled Sutures, Catheters, Needles, and Wires. You can see some correct formatting there. I strongly recommend that you review that. It's not a long section when you're working on your surgical reports in particular. That's got some great information on formatting these kinds of numbers. Just so that you have an idea, a suture size refers to the thickness or diameter of a surgical suture, which they're used to close the wounds or incisions during medical procedures. Suture sizes are denoted by numbers or letters. Larger numbers indicate thinner sutures, while smaller numbers indicate thicker sutures. So the suture system, the very smallest suture you can get is 11-0. A doctor's going to say 11-0. We're going to type it 11-0. That'd be your smallest. And then the largest suture is a size 7. So it would be what if we said a 7 nylon suture? We would not put a hyphen between 7 and nylon. Okay, this is an area that many students struggle with. Formatting the physical exam objective section of the report. Should this be stacked in a paragraph format? And by paragraph format, we mean there's no stacking of reports. It just all flows into one paragraph. So we've got here on exam today, the patient is alert, oriented ×2, blood pressure 120/80, pulse 78, respiratory 16. The lungs are clear to auscultation. HEENT, normal cephalic, eyes are equal and reactive to light, abdomen soft, non-tender, extremities no edema. This one should be stacked. The reason is we've got subheadings. If we take a look at HEENT, H-E-E-N-T, that is a subheading. If we look at abdomen and extremities, those are subheadings. As per the account specifics, the physical exam will be described as dictated. If it's going to be in paragraph form without subheadings, that will just leave it as it is. If we have one subheading, it just takes one subheading, and then we will stack the physical exam as we have here. So even if we just have the one subheading, then we can take the sentences. So you're going to have a mixture possibly of sentences and of subheadings. So when do we create a subheading? Well, a subheading is in a physical exam will be created when the statement of a major body system is dictated without a verb. For example, abdomen is soft. The word is a verb. That's what makes that a sentence. So abdomen is soft, but had the dictator said abdomen soft, we have no verb there. So that would make this a subheading. If that's the only, even if that was the only subheading that he used, we'd still stack everything on top of each other. So helping verbs is really what you're looking for. That's not the only thing you're looking for, but probably the most common. So what's a helping verb? Those are those little words like is, are, were, and was. So often the doctor will say, as we just said, abdomen is soft. There's your helping verb. You might want to write those down. Is, are, were, and was. And also look up on the internet what the common helping verbs are. That's going to give you a clue as to whether you've got a sentence here or not. If there's no verb, you've got a subheading. Okay, so this is how the physical exam is handled. Many students, though, confuse the review of systems with the physical exam, and they'll go ahead and stack that as well. That would not be correct. The review of systems is a subjective report or a subjective section. It is from the patient's point of view. So it's a set of questions that the doctor is going to ask the patient about reported symptoms and concerns, ask how the patient's feeling, any pains or complaints. It can look very similar to a physical exam, but it is from the patient's point of view. It's subjective. So the physical exam, on the other hand, is a hands-on examination by the doctor. So that's where he's going to get his objective findings. He's going to do his vital signs. He's going to look for lumps in the stomach. He's going to do his auscultation of the lungs, that kind of thing. It's a hands-on exam, and he's going to record, or we will record for him, the different numbers that he gets for the vital signs and so on. So do not stack the review of systems. Okay, so this concludes today's webinar. Thank you so much for joining me today. Success is the sum of small efforts. If we just can repeat them day in and day out, we will get to that goal of near perfection. I don't think we'll ever get to perfection, but I just don't want anyone to become too overwhelmed and trying to learn everything at once. A good strategy for helping to reduce errors is to review your account specifics before typing each day. When you get your reports back, track each protocol error back to the spot where it is explained in the account specifics. So if you see that you've got a protocol error, you've done something that has gone against our account specifics. If you have a book of style error, go research it. Open up the book of style. Find out where it talks about that. Review the sound alike words in the book of style, Appendix B. Excellent resource. And if you're really struggling to understand a concept, reach out to an instructor. Sometimes just hearing something explained in a different way can really help. And believe me, if you've got that misunderstanding or confusion on something, I will guarantee many other students have or are currently having that same question. So all questions are good questions. Check out with a instructor to see if they can help guide you through it. I am confident that you're going to start to see your grades improve once you start to avoid these costly errors. One at a time, let's just knock them off, get them off. By the end of the course, you will be having near perfect reports. Again, thanks for joining me today.